Vidyut's whole life is now just, trying to get justice to his wife. One doctor is a director of ICU, whatever they call it, in 5 hospitals. They have no allegiance to anybody. The only allegiance is money. So, Dr. Sunawala is a director in Jaslok, he's a director in Breach Candy. He did not come for nearly 40 days. He's the director of ICU.
When they were putting the food pipe, it didn't go in. So they tried repeatedly to force the tube. And that is where they recorded that there is a hematoma which has been caused. Because they were trying to force the tube. What else will cause the cut in the food pipe? They didn't give me any option. But I said, you're giving me a trial medicine, is there no other medicine available? They said, there's no other medicine available. I kept asking again and again. Only answer I got, this is a very safe drug. Nobody ever told me that what are the side effects, and it's only later when I started reading literature and what that drug is that I realized that it has got side effects. Me and my brother-in-law were standing outside the ICU area and they were doing the bronchoscopy inside. Suddenly there was a lot of commotion. There were these emergency trolleys going into the room. Then I looked through the window and I saw she was totally bloated up. There was air in her face, there was air in her body, but she passed away because she couldn't breathe. Her lungs were full of fluid. That's it.
Vidyut Kak, a retired commander of the Indian Navy, is grieving the loss of his wife, Kavita Kuchru. Vidyut alleges that his wife died because of medical negligence at Jaslok Hospital and Research Center in Mumbai. Vidyut claims that his wife contracted COVID-19 in the hospital. He says she then experienced fungal infections. According to Vidyut, internal injuries occurred during multiple attempts to insert a feeding tube. He alleges she was placed on a ventilator and given a trial drug with several side effects. He further alleges that her lungs were pierced, leading to multiple complications, and she ultimately passed away. Vidyut says it all began when Kavita went for a kidney transplant at Jaslok.
My wife, Kavita, she was earlier a scientific officer, but she stopped working when we shifted to Gurgaon, 2008 onwards. She was at home only. She had taken voluntary retirement. She was a scientific officer at Tata Institute. See, it so happened that she had an issue with kidneys, and what led us to Jaslok, because earlier we used to stay in Bombay, and that's one thing. Second, her uncle is a transplant surgeon at Jaslok, and that was one of the main motivating factors that we went to Jaslok. And the other thing is that the hospital claims that they have 100% success rate on transplants. That's what led us to Jaslok.
This uncle that you talked about, was he the one who conducted her surgery?
Yes, Dr. Raina, he was the one who did the transplant surgery. First thing before the surgery is who the donor would be. And in this case, my mother, who is quite senior, she's 84 years old, but she said, she's like my daughter, so she volunteered to give the kidney, and it so happened that their kidneys matched perfectly. And that's how, when we went to Jaslok, my mother, Kavita, and myself, we had gone to Jaslok, and she was admitted on 9th of July in the hospital, and 11th of July the surgery took place.
Vidyut says that Kavita's surgery went well, with post-surgery tests confirming that the transplanted kidney was in good condition. According to Vidyut, at this point, Kavita's discharge was just a matter of a few days, and she was looking forward to reuniting with her husband in 2 weeks.
post-surgery, the doctors told us that the surgery went very well. The kidney, donor kidney was functioning very well, and in fact they were surprised at how it taken to the body. And I was told that we'll keep Kavita for 15 days in the hospital. The norm is 7 days, but they said we'll keep her for 15 days to be doubly sure. And I said, okay, whatever is the norm is, we'll go through that. And after the surgery on 11th, she was shifted into complete isolation. Family members were not allowed there, and only the hospital staff and the doctors could meet her.
According to Vidyut, Kavita was scheduled to be discharged on July 26, 2024, but then the unthinkable happened. He says that just a day earlier, on the 25th, she developed a fever and was later diagnosed with COVID-19.
24th night, they shifted her to the private room, saying now preparation for discharge. And 25th early morning itself, she started having fever. And then the fever progressed. She had difficulty in breathing, cough, and 29th they said she's got COVID. And the fact that she was in the hospital for from 9th onwards till she got COVID itself shows that she got it somewhere in the hospital. Somebody in the hospital was carrying it. Otherwise, she was fine. She went in fine, and so that's the first event that occurred. Then, they tried to handle her, but things became a little worse, and she was moved into the ICU. The ICU was also, it had rooms all around, and there was the nursing staff sitting in between. There was no control on who was going in, who was coming out. Maybe some people with infection would have been going in, coming out. People visiting other patients, no masks, no control. In fact, I had to tell them many times that, please, she's a different patient. She has come from organ transplant. But, with reluctance they would wear, they wouldn't, otherwise, everybody felt that, as if I was trying to be the monitor around. So that's how it happened, and then she got fungal and her breathing became more difficult. The lungs got more, infected.
How did a patient who was in the care of the hospital for so long, especially a serious organ transplant patient, suffer COVID inside the hospital premises? How did Kavita get the fungal infection? But this was not all. Vidyut alleges that the doctors forcefully pushed a tube through her nose to the stomach, causing bleeding and swelling in her food pipe that raised severe infection risks.
Then on 21st of August, after a lot of time, I said that, the pulmonologist who was treating her, I said, I have no faith in this guy, so I want a change of doctor. So the head of the department came, and he had a look at her, and he said she should be put on ventilator. This should have been done earlier. I mean, she's come to a stage where, sustaining will be difficult. So then she was put on ventilator, and unfortunately, I don't know the hospital dynamics. The second opinion person who had come, he didn't come after that again. So again, same Dr. Jinam Shah kept on treating her in spite of my having objected to it in the first place. Before putting her on the ventilator, they had to put the food pipe. So when they were putting the food pipe, it didn't go in. Now, what I understand, the procedure is if it doesn't go in, you don't force it. So they tried repeatedly to force the tube, and it didn't go in. 4 or 5 times they tried, and it's recorded also that they tried it. Then they called for the endoscopy, assisted insertion of tube, and that is where they recorded that there is a hematoma which has been caused.
Because of the...
Yeah, they have not written because of this, but obviously it's because of that only, because they were trying to force the tube.
Right.
What else will cause the cut in the food pipe, right? So that was big procedural mistake they made. They created the hematoma, and probably that could have, led further to infections going ahead.
Vidyut alleges that his wife's condition worsened due to the lack of care and gross medical negligence at the hospital.
There was a lot of renovation and construction going on in the hospital, which obviously will have dust, and as the literature says, when you have a lot of construction, the chances of the probability of fungal infection being available in the air is much more, because all that which is settled in, when you start hammering and drilling, it spreads with air. When she was shifted to the other ICU, more fungal attacks were diagnosed, and some of them are very dangerous. Then they said, now she's on the ventilator, so we'll start the physiotherapy, etc., so that we can wean her off. They kept saying she's improving. We'll wean her off, and once she is off the ventilator, then she can go home. She was admitted in July, and this has been going on and on and on. So on around September 7th or so, they said that she has got now a multi-drug resistant infection. So they were treating her with the medication.
Vidyut alleges that the multi-drug resistant infection was again hospital acquired, just like COVID-19 and the fungal infection. But now, according to Vidyut, the most shocking thing happened. The patient was administered a trial drug.
Then Dr. Bahadur came up and said there is a trial medicine from Wockhardt, and that is supposed to be good for this type of multi-drug resistant infection, so we'll try that. And I said, okay, I mean, there's no option, they didn't give me any option. But I said, you're giving me a trial medicine, is there no other medicine available? They said, there's no other medicine available, and this is the only medicine. And so I was made to fill the application form which goes to the Drugs Controller of India. Application that I want this on compassionate grounds.
Did they inform you about the risks of the drug?
No. I kept asking again and again. Only answer I got, this is a very safe drug. Nobody ever told me that what are the side effects. And it's only later when I started reading literature and what that drug is, that I realized that it has got side effects. But since this was a trial drug, there is no published literature in open source which we can read about this. It's only about the ingredient, cefepime, that cefepime has XYZ this thing, but nothing about the other part of the medicine.
What side effects did you find about the drug?
So what I found is that it is neurotoxic, it is nephrotoxic, and it also said that if it is given to transplant patients or kidney patients, you have to be very careful and monitor. So what happened then, when I applied for this drug, etc., and then the process took place, then on around 14th September, they said that there is a patch in the lung and we'll do bronchoscopy to see what is that. So they did the bronchoscopy, and me and my brother-in-law were standing outside the ICU area, and they were doing the bronchoscopy inside. Suddenly there was a lot of commotion. There were these emergency trolleys going into the room. There was this trolley which is used for giving shock, no? That was going into the room. So we didn't know what was happening. We tried to ask, nobody told us. After 15-20 minutes, everybody came out. And when we said what happened, they just started looking at each other. Then I looked through the window and I saw she was totally bloated up. There was air in her face, there was air in her body. So nobody said what happened or how. They said no, it happened, and she had a breathing problem, and her heart rate was going down. So we had to give her CPR. Then we asked, then why did you take these machines inside? They didn't have any answer. They didn't tell us also what happened inside exactly. But later when the X-ray came, it showed that she has got tension pneumothorax. Now, tension pneumothorax is a very dangerous thing to happen, because in layman terms they say tension pneumothorax happens if the lungs get pierced, say suppose a motorcycle accident, something like that. And it's not something which can happen with a bronchoscopy in a hospital of Jaslok's repute.
According to Vidyut, after the trial drug was administered, more complications occurred. He states that her lungs were punctured while performing another medical procedure, and Kavita started slowly slipping into a critical condition.
They had to take her into emergency operation theatre. So they had to change the pipe here, tracheostomy pipe, and suck out the clots which were formed. Then they had to put pipes through the chest, make holes on both sides so that the air could be drained out, because the air had gone into the, what they call it, pleural cavity, where all the organs are there. So everything was pressing. So they did that, and till that 14th morning she was very cheerful. In fact, just 2 days before that she spoke to me. They had put an odometer on her throat. So on the phone she spoke to me. She spoke to her son who is in US. So things were okay, we thought okay, and they told us 2-3 days more and she'll get strength and we'll discharge her. But then this happened on 14th, and somehow that was the downslide sort of started from that day onwards. Her hemoglobin count was fluctuating. Nobody looked at that, why it's going up and down. They just kept giving a transfusion and things like that. Then on 16th this medicine arrived. On 16th evening they gave her the medicine. Again I asked, does it have a side effect? They said it doesn't have a side effect. 17th morning I saw her dull. And I told the doctor that she is looking dull. And in fact, 2 of the own doctors have recorded also in their notes that she is not looking cheerful, she is looking dull. And I asked Dr. Bahadur that, I in fact told him that probably, is it because of the medicine that she had on 16th night? He said, no, it's not because of the medicine. And they continued the medicine. And 19th morning she had seizures. So she had seizures, and then they called the neurologist, etc. So they had to do her ECG, things like that. And neurologist has also written that this is cefepime-induced seizure. So they stopped the medicine. Which probably, if they had monitored, if they had listened to what I was saying, probably seizure would not have taken place, right? If they had stopped it on that day only. They didn't stop it, they continued.
Soon after, Kavita passed away in the hospital. Vidyut states that he was a witness to a series of medical negligence that occurred in the hospital, which led to his wife's untimely death.
On 24th, which also happened to be her birthday, the doctor doctor in the evening called me. I had just gone down to have tea. He said, "You come immediately." The ICU specialist who was there. I said, "What happened?" He said, "Her hemoglobin has dropped drastically and we don't know why it has dropped. I am taking her to the CT." So she was rushed to the CT and they found she had lost 1.8 liters of blood. Nobody noticed it all the time. 1.8 liters. Now imagine a human body, 5 liters of blood, 5.2 liters of blood, out of which 1.8 liters is lost. What is going to happen? So then she was rushed to the radiologists who found out that there was one of the blood vessels, small blood vessel, which was leaking. Then they patched that blood vessel. 27th night I was throughout there only. So 27th night the registrar told me that doctor has said that and they had put a dialysis machine to take out excess fluid from the body, because once blood products are given too much, then the fluid in the body rises. So they had put a dialysis machine on slow, this thing, to take out. And she said that, we are on target and we are taking out the fluid as per what has been told to us. And then in the morning she said only 300 ml more is left, so it's fine. I mean, we'll take it out slowly. But suddenly what happened is that the fluid levels kept on increasing. They couldn't remove the fluid at the same rate. And around 11 she passed away. And her kidney, transplanted kidney, was working even then. But she passed away because she couldn't breathe. Her lungs were full of fluid. And that's it.
Kavita's passing has left a deep void in the family. Since her death, Vidyut has been fighting for justice for his wife and to hold the hospital accountable. Kavita's brother Kaushik states that their family is not the same as before, with everything having changed after her death.
Vidyut is left alone because he has only one child. Okay, he is in the States. Vidyut's parents have taken it very badly. My father, who's 85, does not want to talk on the subject. He says, because he's very clear on two matters. He says he has, because my mother also passed away in Jaslok, and he feels, okay, Jaslok as an institution is not really worth the reputation it has. And that care part has just hurt us so very badly. I and Vidyut just don't talk on any other subject except this one. Vidyut's whole life is now just, trying to get justice to his wife. One doctor is a director of ICU, whatever they call it, in 5 hospitals, 4 hospitals. How can that be possible? They have no allegiance to anybody. The only allegiance is money. So, Dr. Sunawala is a director in Jaslok, he's a director in Breach Candy. He did not come for nearly 40 days. He's the director of ICU. And he's, 75, 80. There's no retirement doctors have. And why they behave like they are gods? They come for 5 minutes in a day, 10 minutes in a day, and you wait the whole day to be blessed by their presence. I have lost faith in this medical profession in India completely. I would prefer maybe dying than getting into a hospital.
Throughout her life, Kavita had influenced many people around her. She was known for her kindness, compassion and affection. Her house help Ranu remembers her fondly with tears in her eyes.
उन्होंने हमारे लिए एक भगवान की तरफ थे, बहुत अच्छा, जैसे हमको बच्चों की तरह संभाल लेते थे, हमको जीना सिखाया। हम बाहर के, एकदम कलकत्ता से आई हूँ, तो एकदम गांव से आई हूँ, मुझे कुछ पता नहीं है यहाँ के बारे में। उन्होंने हमको जीना सिखाया, यहाँ कैसे चलना होता है, किसके साथ कैसे बात करना होता है, क्या करना होता है, सब कुछ सिखाया उन्होंने। जैसे बच्चों को सिखाती है ऐसे ही हमको सिखाया, हम उससे जीना सीखा। जब घर में घुसता है पहले ही क्या खाया, क्या किया, घर में कौन है, कैसे है, सब पूछता है। काम के लिए कुछ कभी भी बोलता नहीं था। फिर उन्होंने बहुत हमको संभाला, बहुत संभाला। मेरे को भी माँ बाप से भी इतना प्यार नहीं मिलता था, उन्होंने हमको इतना ज़्यादा प्यार से बड़ा किया, बहुत अच्छा को लग रहा था उनके। फिर हम जाते रहती थी, हम लोगों को तो घुसने नहीं देती थी, तो हम लोग आईसी रूम से बाहर से उनको देखते थे। तो
We sent a detailed set of questions to Jaslok Hospital and Research Center to seek their response on the allegations of medical negligence. We did not get answers to our questions, but a standard response from the hospital. Here's what the hospital stated in their reply to our queries. Our deepest condolences go out to Mrs. Kuchru's family and all who have been affected during this difficult time. Mrs. Kuchru was admitted for a renal transplant and remained hospitalized for over 3 months due to COVID-19 related complications. During this time, our team adhered to international protocols and delivered the highest standard of care. As the matter is currently sub judice, we are unable to provide further comments at this time. We have fully cooperated with concerned authorities and shared all relevant information with the patient's family and appropriate legal bodies. At Jaslok Hospital and Research Center, the well-being, dignity and care of our patients remain our highest priority, and we are committed to upholding the trust placed in us. Vidyut has filed a complaint with the Haryana Consumer Disputes Redressal Commission, contending that his wife's death resulted from medical negligence, gross deficiency in services and unfair trade practices at the hospital. The commission has issued notices to the hospital and the involved doctors, with the next hearing scheduled for October. Vidyut continues to pursue justice through legal channels while adjusting to life without Kavita. He returns each day to a quieter home, still coming to terms with how a single hospital visit turned his life completely upside down. Yet, in the quiet moments, the memory of Kavita's melodious voice lingers, bringing warmth to his solitude.
मैं कहाँ चला